Good morning. I'm Dr. Larry Bergstrom at the Mayo Clinic. I'm the director of the Complementary and Integrative Medicine program. And I'm very pleased to talk about our new massage program for oncology patients in the hospital. This is a very welcome addition to the treatment we have for patients with cancer.
Hi, I'm Barb Hudak. I'm one of the nurses here. I'm a house supervisor at Mayo Clinic in Arizona, and I've always been interested in holistic therapies and integrative therapies. And as a nurse, I've sat with a lot of patients as they've received their initial diagnosis of cancer, and I know how stressful that can be. I know what kind of journey they're heading towards. So knowing that cancer treatment can have a lot of side effects, whether it's radiation, chemotherapy, surgery, and bone marrow transplantation, it can leave patients with a lot of side effects like weakness, being tired, nauseated, and in pain. And over the years, we've received a lot of requests from patients for massage therapy. So we decided to investigate, looked at some research, and we found a really great therapy that is gentle, comfort-oriented, and it's safe for just about anybody going through cancer therapy.
Oncology massage is comfort-based, it's comfort-oriented, so the touch is adapted to whatever the patient is dealing with. It depends on the kind of cancer that they have, the kind of medications they're using, and all of that is taken into consideration when I'm putting together a care plan for them. So depending on what they're dealing with, the massage is tailored to what they're dealing with. Low platelet levels, you're going to have very light touch. Certain medications, you're gonna do things a little bit differently. So it's really comfort based.
Now, a lot of our physicians have already been prescribing massage therapy for their patients outside of the hospital. And when we approached them, they embraced the program but wanted to see the research first.
There's many studies that support the benefit of this sort of treatment. The studies very strongly support the idea that it's beneficial for nausea, pain, anxiety, which are all things patients being treated for cancer in the hospital experience.
There are specific things that can be done through oncology massage to really give these patients a better quality of life. And I know that's a huge thing, that's important for them. And it's also important for the nursing staff because they spend a lot of time caring for their patients, and I can tell that the nurses at Mayo, they really love their patients.
I'm a nurse here at Mayo Clinic Hospital. I work with bone marrow transplant patients. A few weeks ago, I had a patient that was experiencing a lot of pain in his back. Here at Mayo, we use a pain scale, and it's 0 if you have no pain and 10 if it's the worst pain you could imagine. His pain was between a 6 and an 8 throughout the day, and I was giving him narcotic pain medication, and no matter what I gave him, his pain never got less than a 4. We were fortunate because on that day we had our massage therapist available, and I asked the massage therapist to come in and work with him. He worked with him for 1 hour, and during that time I made sure that he had no interruptions, so the patient had 1 hour of uninterrupted massage therapy. After that time, the patient rated his pain a 0 out of 10. And that was the lowest his pain had been all day.
So one of our goals is to really raise awareness and consciousness about this oncology massage program. And the goal is to find opportunities to offer this treatment to every patient who's interested in it at any level of their cancer treatment at Mayo Clinic in Arizona, whether it's in the hospital or just during a follow-up visit with their physician.
So I'm very pleased to announce that this program is available now, and I encourage anybody in the hospital who they think may benefit from this to ask for it. Thank you.